how would you feel if your professor was an avid drug user? And I'm not just talking about like occasionally drinks alcohol or does some marijuana here and there, maybe smokes a cigarette, whatever. I'm talking about your professor does the hardcore stuff like methamphetamine, heroin, occasionally dabbles with psychedelics like psilocybin, LSD. And not only that, they're a bigwig professor at a big university and they're completely transparent and open about their drug use. How would you feel? Like you just went to class one day and your professor's like, yeah, I do methamphetamine like once, twice a week. I do heroin maybe once, twice a week. Just depends on how I feel. And I asked you that because I just finished this book. It is called, it's called Drug Use for Grown-Ups. And in this video, I thought we would kind of explore the concepts and ideas behind this book. It's written by the professor of psychology at Columbia University, who is a drug user. And I'm not joking when I say he uses methamphetamine probably once or twice a week, as well as heroin. He talks about it in his book, Drug Use for Grown-Ups. And I found this guy actually by listening to a Joe Rogan podcast, and it really caught my attention. I was like, God, I got to get this guy's book. So I got his book. I've read the thing. I think I'm actually going to reread this book just because I thought there were so many interesting points in it. But I've made some notes here. I thought we'd go through my notes. I'm going to read some excerpts from the book, and we're going to discuss it. I discovered that the predominant effects produced by the drugs discussed in this book are positive. It doesn't matter whether the drug in question was cannabis, cocaine, heroin, methamphetamine, or psilocybin. Overwhelmingly, consumers express feeling more altruistic, empathetic, euphoric, focused, grateful, and tranquil. So Dr. Hart believes that these substances, methamphetamine, heroin, etc., actually enhance our lives in a number of ways and are not actually that detrimental. And he talks about how he used to believe the standard drugs are bad narrative, and then after doing years of research, medical research, after his own experience, after interacting with other people who've had lots of experience with these kind of drugs, he changed his mind. And the crazy part is, I mean, after reading his book, it's, he presents a lot of good evidence, and I'm kind of fairly swayed towards his point of view. It's just, I'm so indoctrinated with the narrative that drugs are bad that it's really hard for me to believe otherwise. So I remember being in 5th grade, I'm pretty sure it was 5th grade, and we had to sign this banner stating that we would never ever use drugs. It was part of this DARE campaign. I think that stood for like drug abuse resistance education. And it was basically like all drugs are bad. And they just crammed it down your throat. I'm sure they had like very minimal evidence of any kind. But when you're young and impressionable and you're in 5th grade and you have authority figures telling you that drugs are bad, you kind of just believe it, right? And then as you age and you see people who are on drugs and it looks like they're going through hell, that reinforces that narrative that drugs are bad. But I read his book and I looked at a lot of the evidence and I'm like, I want to believe what he talks about in here, but at the same time, I'm so attached to my previous belief, if that makes sense. And I kind of think like, I don't know, there's something Cartesian about this. Descartes, I remember if you read his meditations, there's this time when he's sitting in front of a candle and he's really questioning all his beliefs and where his beliefs come from. And I've started to do that a little bit with my beliefs about illicit substances. And I'm like, dude, where did I get this belief that they're bad from? And I'm looking at it, I'm like, bro, you don't actually really have that good of evidence. I haven't been following really the evidence at all. I haven't even looked at peer-reviewed literature about drugs. I'm just going off what I've been told by authority figures and just a few experiences I've had interacting with people who appear to be on drugs. And that's kind of the basis for my belief, which is really horrible. Like that is so completely unscientific that, yeah, I don't even know what to say. All right. So I want to get back to some of the statements he makes about illicit substances in his book. This is on page 14. It says, heroin and other opioids, such as oxycodone and morphine, bring me pleasurable calmness, just as alcohol may function for the drinker subjected to uncomfortable social settings. He then mentions how he is entering his 5th year as a regular heroin user and how he does not have a drug use problem. Then on page 39, he mentions how he is frustrated that he can't use his heroin as openly as other people can use alcohol. Dr. Hart is completely right. I mean, he cannot enjoy his heroin as openly as he might be able to enjoy his alcohol. Heroin, at least in the States here, is a Schedule I substance, and according to our omniscient drug enforcement agency, essentially essentially means it has no valid medical use and a high potential for abuse. And according to a legal website that I found, it's a first offense of possession of an illegal substance such as heroin could potentially lead you up to a year in jail or a $5,000 fine. So it's way too risky to enjoy heroin publicly. So I want to move on to what he says about methamphetamine, and we will look at some of the evidence that he cites in support of his view that drugs are not as bad as we think they are. He says, without a doubt, amphetamines are our favorite substances to take in our moments of united solitude. He's talking about himself and his wife. And that because of his ignorance, he avoided taking amphetamines for much of his life and would not first try them until after he turned 40. And he's actually even embarrassed to admit that it took him until he was 40 years old before trying amphetamines. Even more embarrassing is what I used to say in response to queries about why I had never taken an amphetamine. My response went something like this: I don't need them, nor do I need any drug. And then he says, of course, I didn't need to take any drug, just as I don't need to travel by car, train, or airplane. I can simply travel on foot. When traveling over great distances, the other methods are simply far more practical and enjoyable. Then he goes on to talk about amphetamines, how they can enhance pleasure, openness, intimacy, energy, sexual satisfaction, and a range of other experiences normal people routinely seek. Then he says, few would balk at using Viagra or Cialis to enhance sexual performance, but many more find it objectionable to use drugs such as amphetamines to improve the sexual experience. And I just think what's crazy is this, like, so this guy is a professor of psychology at Columbia University, writes a book about this, so they know that he's an avid drug user, and he still maintains his job. That's kind of cool. I mean, he's very functional, obviously. It's not as though when I'm reading his book, it doesn't make sense. It's not as though when I heard him interviewed on Joe Rogan that he was out of his mind or anything like that. He sounded completely intelligent, coherent, and all of that good stuff. So then on page 118, he tells us about the very first time that he took an amphetamine. He says it was his 40th birthday. This was on October 30, 2006. And he was headed to a meeting, and his friend Lorraine, he was on a train. His friend Lorraine had a prescription for the drug, and she had given him a couple of pills as a gift. Lorraine frequently teased me because I was considered an expert on amphetamines, but had never actually taken any myself. And then he says that he sat on the train feeling alert, mentally stimulated, and euphorically serene. And then he had this kind of thought to himself. He says, I wish others too could experience this feeling, I quietly mused to myself, and the world might be a happier and better place. At that moment, the world was all right to me. Then he mentions once the drug has worn off, he says, I didn't crave the drug or feel an urgent need to take anymore. I certainly didn't engage in any unusual behaviors, hardly the stereotypical picture of a meth head. And I'm sure many of us are familiar with the marketing around anti-meth campaigns. It's like, meth, don't even do it once. And yet here he does meth once. And he's saying, hey, I didn't really have that same effect. Like, it didn't just completely obliterate and ruin my life. In fact, I had quite the opposite experience. So then Dr. Hart mentions some of his research around meth. And this is where I really feel like it gets interesting. There was a study he conducted where participants could choose between $1 of cash or a low hit of methamphetamine. These were meth addicts, right? It's not like this was not like a placebo-controlled randomized study of any kind, right? So they took meth addicts and they say, hey, look, here's 10 milligrams of meth, which is apparently kind of a lower hit of meth, or here's $1. And about half the subjects chose $1, the other half took the hit of meth. Then when they upped it up to $5, the subjects would take almost all the subjects would take the $5 and not the hit of meth, and they didn't receive the money right then and there. They had to wait a few weeks until the study was finished, and then they could receive the money, which is curious, right? Because it's like, if I had told you, if someone had asked me, hey, hey, Nick, they're going to do this study with meth heads, right? Meth addicts, they're going to offer them $5 or a hit of meth. What do you think they're going to choose? I'm like, oh, the hit of meth. I mean, they're addicts. They don't have a choice, right? Well, his study is showing otherwise. If meth was that addictive, then we would know that they would have to take the hit of meth. They wouldn't have to wait for weeks to get $5. And I don't even know how much meth costs. Like, maybe you can get a decent amount for $5. I have no idea. But at least I think that kind of indicates that meth is not as addictive as we think it is. And that whole like not even once thing doesn't really even make sense. Then Dr. Hart mentions another study in his book. And one of his frustrations is he says that anytime a study about illicit drugs, and I shouldn't say anytime, but it's probably most of the time a study comes out about illicit substances and it shows some sort of positive effect, an effect that contradicts the standard drugs are bad narrative, he says those kind of studies rarely get any press. So the study he cites in his book on page 105, this was a study done in 2006 in the journal Psychopharmacology, and it used brain imaging to compare the brains of methamphetamine addicts with non-addicts. And so the study shows that dopamine binding in the midbrain was 10 to 15% less than non-addicts. So people who did meth, they have less dopamine binding in the midbrain. And then the study also measured cognitive functioning between the two groups and found that methamphetamine users performed equally well on most cognitive tests. Equally well on most cognitive, like, isn't that weird? A meth addict is going to perform equally well on cognitive tests as their counterpart who does not use meth. I mean, it's crazy. It's just, it blows my mind. And it says that, okay, meth users did show some deficits in sustained attention and immediate and long-term memory, but those deficits still fell within the normal range of functioning for their age group and education level. So it's not as though that, like, a meth addict all of a sudden does meth and their brain is just eaten away by the meth, because if it was, we would definitely see a cognitive deficit. And his study, the study that he's citing here, is not showing that whatsoever. And look, like, obviously this is not the best study ever. It's not a placebo-controlled double-blind study, but at the same time, these are meth addicts. If meth really does rot the brain, and I think 15, 20 years ago, I remember this ad that I saw on TV about methamphetamine, and it had to do something with either, I can't remember if it was a female or male, but they were like scrambling eggs or something. And then it says like meth, not even once. And then they just like throw the eggs and they just lose their mind. And where did they even get that from? Like, where does that narrative come from? If meth really has that effect on people, where is the research that shows that specifically? That's what I want to know. And my hunch, really, after reading this book, I really think that's just BS propaganda that isn't backed by any research whatsoever. So then what is going on? If the drugs are bad narrative is false, what is happening and how did we get to this place? So Dr. Hart believes that the reason we have this drugs are bad narrative stuck in our heads is because on page 118, he says, perhaps it has something to do with so-called public education campaigns aimed at discouraging methamphetamine use. These campaigns usually show in graphic and horrifying detail some poor young person who uses the drug for the first time and then ends up engaging in uncharacteristic acts such as prostitution or stealing from parents, neglecting basic survival needs, and assaulting strangers for money to buy the drug. And then he says at the end of one campaign advertisement, which is what we talked about, emblazoned on the screen as meth, not even once. In fact, when I read this part of the book, I thought locally here, I've come across some anti-meth advertisements. The one that I see is there's this giant pill bottle, and you see behind this pill bottle, this person stuck. They look desperately trying to crawl out of this pill bottle, and it says meth, not even once. Or I think of like all the pictures we've seen of people who are before and after meth addicts, and you usually see them on like some sort of police or law enforcement website, and it's like, oh, this is what they looked like 5 years ago, and then this was after all the meth, and now this is what they look like. And then Dr. Hart gives a popular example of how the media and pop culture sort of influences our ideas on methamphetamine. He talks about the TV series Breaking Bad and how Bryan Cranston, one of the main actors in the show, was interviewed about meth, and this is what Bryan Cranston said. He said, meth is such a horrible drug because it makes users continually pick at their skin in search of imaginary bugs crawling underneath. And Cranston continues, in the beginning, your brain is producing dopamine along with the drug, which creates the most euphoric high. Users get hooked, he explained, because after a couple of uses, the drug fails to produce euphoria, and then users are only left with their addiction. Dr. Hart gives another example of the drugs are bad narrative regarding meth on page 119. He says, we've also seen those infamous meth mouth images wrongly presented as a direct consequence of methamphetamine use. This is what he says in rebuttal to that. He says, sure, dryness of the mouth is a side effect of methamphetamine. It's also a side effect of other drugs, including several antidepressants and Adderall. Millions of patients use these medications every day, but there are no reports of dental problems associated with their use. The phenomenon of meth mouth has less to do with direct pharmacological effects of methamphetamine and more to do with non-pharmacological factors ranging from poor dental hygiene to media sensationalism. Meth mouth is probably more fiction than fact, which is kind of interesting because if street meth is very similar to amphetamines or methamphetamine derivatives, Adderall, Concerta, etc., then why? I mean, I can't tell you how many people I've seen who take Adderall, Concerta, Ritalin, etc., and they don't have meth mouth. So what is going on here? If street meth and those drugs are that similar, then we would expect to see meth mouth in people who take drugs such as Adderall. But we don't. At least I haven't seen it. And I will say, after working in mental health, I mean, we have a ton of patients who have a mental illness. They do methamphetamine, they're psychotic, and then you look at their diet. Like when I worked outpatient, for instance, and I would hang out with my beloved patients, they would use their food stamps to buy nothing but sugar, cigarettes, and pop. And these were also people who did methamphetamine. And I think if you took away the methamphetamine, it wouldn't matter. They're still going to have meth mouth just because of their diet and poor dental hygiene and just stress, the amount of stress and just poor immunity and living out on the streets, living just a really rough life. So I'm glad that Dr. Hart talks about this meth mouth, and I'm glad that he questions it, because now I find myself questioning. I can't say for certain that meth actually causes meth mouth. I don't know. What are your thoughts? Maybe I'm crazy. And then to support the fact that street meth is kind of similar to amphetamines manufactured by a pharmaceutical company, Dr. Hart does mention how this is what he says in his book. He says, all amphetamines are chemical siblings, and that methamphetamine produces nearly identical effects to those produced by Adderall. And that users, when given the opportunity, will choose a drug like Adderall as frequently as they choose meth, because the effects of the drug are indistinguishable, according to research Dr. Hart has himself conducted. So in other words, if you get a meth head and you offer them either their meth or their Adderall, they're not going to know which one to choose. They're just going to choose either or, because to the meth user, they're indistinguishable. They can't tell the difference between one or the other. So I don't want to belabor our talk on methamphetamine. The book is not just about methamphetamine. I guess for me, though, it is very hard to separate my own personal experience observing people who appear to be under the effects of methamphetamine and what Dr. Hart is saying in his book. There's one instance that really stands out to me when I was just walking my dog once in my city along a sidewalk in kind of a rougher part of the neighborhood. I passed this guy who appeared to be under the influence of meth. I mean, I just, in my head, I have no idea. Really have no idea. It's just, he seemed very hypervigilant, alert. His fists were clenched. He seemed so freaking aggravated and amped. And we were in sort of a calm situation, just a walk on a nice sidewalk. And as I passed him, I just remember thinking, holy crap, like this guy looks so pissed. And it's funny. It's just funny because it's really prejudice on my part. I have no idea what's going on in that guy's world. I mean, maybe he has a non-pharmacological explanation for why he's feeling the way that the guy couldn't have, maybe he wasn't on any substance whatsoever. It's just funny how I automatically assumed he was on a substance. I mean, he looked pretty rough. He probably was on a substance, but even if he was taking meth, how do I know that the way that he was behaving there was a direct result of the methamphetamine? I don't know. I really don't know. I think it's just a bias that I have about meth. I've never thought meth had any sort of like legitimate use. And then I read this book and now I'm like, sweet mother of God, maybe it does. So I want to go back to talking about heroin because he shares an interesting experience in his book with an internist. This is a kind of an acquaintance of his who is an internist in Switzerland. An internist, if you guys know internists, they are very intelligent medical doctors that know, I feel like, everything about the human body. So he has this acquaintance who works in Switzerland inside of a drug clinic that is an internist, and she works very closely with heroin. I don't want to say addicts, but routine heroin users. And she's a huge fan of heroin. This is a medical doctor who is a huge fan of heroin. And this is what he has to say about this experience. This is on page 223. He and this internist they go for a hike. Her name's Barbara. And she says, heroin is one of the safest drugs. So she does qualify her statement. She says that if you attend carefully to the dose administered and the user's level of tolerance, heroin is a very safe drug. So Dr. Hart, when he's having this conversation with her, he says he can't even remember what he said, but he was just in such disbelief. He's like, you got to be kidding me. And she wasn't. She said she continues by telling Dr. Hart about her experience working with patients in her heroin clinic and how these folks do with its treatment. Many of them are also afflicted with other illnesses, including psychiatric disorders. She stated that heroin, and this is crazy. She stated that heroin, compared with antidepressant and antipsychotic medications, has far fewer side effects. Okay, well, that's not crazy. The next part is crazy. One of her most consistent clinical observations as she's working in these heroin clinics with people who have dual diagnosis, like a mental illness plus a substance use disorder, is that heroin is more effective at controlling psychotic symptoms, such as hallucinations, in many patients than are traditional antipsychotic medications. So then Dr. Hart says, initially this was a bit much for me to digest, but once I got over my shock, I could at least see how this might be theoretically possible. So he's going to give us an explanation of how something like an opioid, something that's very sedating like heroin, might help with psychosis. He says antipsychotics are the drugs used to treat schizophrenia and other psychotic disorders. The dominant theory purports that psychotic behaviors, including hallucinations and delusions, are caused by overactivation of dopamine cells in the midbrain. Antipsychotic drugs block dopamine receptors and thereby prevent excessive dopamine activity. And then he continues, supposedly these drugs eliminate voices in the heads of schizophrenic patients and reduce their delusions. In reality, and if some of you have watched some of my other videos, it's not that simple. Antipsychotics are not a cure. Many patients report that these drugs don't necessarily rid them of the voices in their heads, but rather they make the voices less frightening. In some of my other videos, I've talked about how antipsychotics sort of blunt our spontaneity and blunt our experience of the world. And this is what I think he's referring to here when he says they make the voices less frightening. The voices are still there, but the person doesn't really care about them as much. He says, in other words, antipsychotics are not magic bullets that selectively target psychotic symptoms. They are blunt tools that cause a cascade of effects on multiple neurotransmitter systems. He talks a little more about this, but I want to get to his explanation of how heroin might address psychosis. He says, heroin also produces a range of neurobiological actions, including some leading to sedation. But unlike antipsychotics, heroin engenders many positive effects on mood, including remarkable feelings of well-being, which, as you know, if you've watched some of my other videos, antipsychotics do not do that whatsoever. In fact, they cause the opposite effect. You don't generally feel good taking an antipsychotic medication. So then he says, so yeah, I can see how heroin might be more effective than many antipsychotic medications at quieting the voices in the heads of some patients suffering from psychosis. And then he says, and this is a great point, I didn't even think about this, but this is a huge point. He says, I also can see how the drug might be more reinforcing. If patients like it, then they are more likely to take it. By contrast, antipsychotics don't do that, right? People take antipsychotics and I'm like, oh God, I can't stand the way they make me feel. Even if they do help with my psychosis, a lot of patients are just like, I don't know if it's worth the way that they make me feel. Whereas heroin, if it's sedating, if it does help with psychosis and it also makes them feel good, well, then they're going to continue taking it. And we know, especially, I can say from working outpatient, so many patients stop their antipsychotic medication because they just don't like the side effects. They don't like the way that it makes them feel. And so what his internist friend is saying is that heroin actually does a better job overall than antipsychotic medication is as far as reducing psychosis and managing psychosis, which is great. Like this, when I read this, I was like, what? You've got to be kidding me. I really want to look at some really good peer-reviewed research about psychosis and heroin. There's another book I'm reading now. I think it's called Manufacturing Depression. And they're talking about the use of opioids in psychosis. And I think perhaps that's something we did way back in the day. I'm not sure as of yet. So anyhow, he ends up spending an entire day with her. And then he's like, I really need to learn more about heroin. So she invites him to her heroin clinic. And as he's there, one thing that he observes that he mentions in his book is that he had this preconceived idea that heroin addicts were not good at keeping a schedule and were kind of fickle and maybe wouldn't show up on time. But in the heroin clinic that he observed, these patients had to be there twice a day. And he said they were always on time. They were there all the time. They were very reliable people. And he's like, what is going on here? This is contradicting my idea of what a heroin addict should look like. Irresponsible, forgetful, lazy, maybe so sedated they forget to come to the clinic. I don't know. Another important point he makes in his book is heroin is not really as addictive as people say it is. He says that despite the current false narrative, the addiction rate among people prescribed opioids, so these are people who have a valid prescription, for pain in the United States, for example, ranges from less than 1% to 8%. I mean, if it's 8%, I feel like that's kind of high, but if it's less than 1%, I mean, that's barely next to nothing. And then he says, I now know too that most heroin users do not become addicted to the drug. Your chances of becoming addicted increase if you are young, unemployed, and or have co-occurring psychiatric disorders. And he says, this is why the Swiss ensure that all heroin patients have a social worker, a psychologist, a psychiatrist, and other health professionals as part of their treatment team. Not only are medical and mental health issues addressed, but crucial social services are provided as well. All patients have housing, and many are employed. Man, that's freaking awesome. I wish we could get it right like they do in Switzerland. As we get to this point in the video, I guess there was something that's popping in my head, and I don't feel like this is a point that he addressed in his book, at least directly. And it really irked me. Like, I was like, bro, we really need to know this information. But like, how do we know that the heroin that people are getting off the streets, the methamphetamine that people are getting off the streets? I'm in Colorado, so prior to legalization of marijuana, how do we know that street marijuana that people are getting off the streets is the same as what would happen in a well-run, well-oiled manufacturing machine that was FDA approved, that was regulated by our government? Like, how do we know the Adderall that people are taking as a prescription pill is that similar to meth on the street? Because we don't really know. And you always hear stories about things being laced. So I wish he would have addressed that in his book. And he does mention how there's other countries who have these drug testing sites. I think one of the countries he mentioned was Portugal, where apparently a lot of drugs are decriminalized. And Portugal has these drug testing sites where if you get something on the streets like methamphetamine, you can bring it to these drug testing sites and they can tell you, hey, what % of this drug is meth? What are the other maybe inactive ingredients? And then I think, man, where is this in the United, like where are we in the United States? Because I feel like we're so bass backwards. And that could be part of the reason that some users aren't having a good experience with their street drug, because who knows what their street drug contains. I mean, I hear stories all the time about fentanyl popping up in all sorts of different street medications, or that they're cutting drugs with fentanyl, that somehow fentanyl is making its way, fentanyl's an opioid that's somehow making its way into all these different illicit substances. So I feel like to some degree, although he makes a very strong case for regulated illicit drugs, so to speak, if that's not a contradiction, he makes a very good case for those drugs being safe. What about street drugs? What about street drugs? Because they're simply not the same. So I wish he would have addressed that in his book. Something else that really stuck out to me in his book is Dr. Hart used to abide by the drugs are bad narrative. That used to be his own personal belief. And then, and only then, after having so much personal, professional, and medical experience with all these illicit substances, then and only then did he change his mind. And I'm like, bro, like what are we to say for the rest of us who don't really have the same experience as Dr. Hart? If it took him, I don't know, I want to say in his book, it took him like 20 years or so before he kind of changed his opinion. And even if it wasn't 20 years, I mean, it was a long time, lots of medical research, lots of personal experience, lots of interacting with people who have lots of experience with all these illicit drugs. If it took him that long, like what are we to say for the rest of us who are constantly spoon-fed the drugs are bad narrative, or who might even have personal experience like, yo, I took meth once and that's all it took and now my life is ruined. Or, you know, I have a family member who took meth and now their life is ruined, etc. I guess my point here is like Dr. Hart is extremely intelligent and it took him such a long time to change his opinion. What's to be said of someone like me who occasionally when I'm on TikTok, you see these horrible videos of people who are stooped over and they look like heroin addicts and they look like their lives are ruined from drug use. What are we to make of that? I think Dr. Hart's response would be that, yes, you do have some people whose lives are ruined, potentially, by a drug, but not necessarily because of the drug. And these people, I think he would say, have a horrible relationship with the drug. And the drug probably has infiltrated their life to the degree that it makes that person very difficult to live a happy and normal life. But at the same time, what I think he would point out is that your average person who might fit this category as an illicit drug user whose life is horrible, it wasn't just because of the drug. Their life was probably already horrible before they started the drug. They probably had lots of trauma. There was probably some sort of mental illness. There was probably lots and lots of abuse. And you have all these other sort of factors that are negatively affecting this person's life. And on top of these factors, you're going to add the drug, and the drug compounds and exacerbates their problem. But it's not like you could just take a happy and successful individual, give them methamphetamine, and then all of a sudden they're going to wind up like that person. No, because they need that trauma. They need that abuse. They need unemployment. They need a ton of stress in their life before they would reach that point. I think at least that's what Dr. Hart would say. He doesn't really directly address it in his book. And then there's the potential for all the flip sides that maybe we don't see, the positives of drug use. Like maybe, I don't know, we come across someone who's very happy and highly motivated and energetic. They come to work and they're super productive. Maybe they're an in the closet methamphetamine user, or maybe you have a cashier that you interact with on a regular basis and they're super, I don't know, just chill and calm and kind of compassionate. And maybe they wake and bake before they come to work. Or maybe you've got someone who used to be cantankerous and disgruntled and they freaking hated the world, and now all of a sudden they've kind of lightened up a bit, and maybe that's because they started using heroin and it's treated their chronic pain. I don't know. I'm just saying, I think the reality is, as he mentions in his book, illicit drug use is a multi-billion-dollar industry here in America. In fact, when I Googled it, maybe people in the US spend around $150 billion per year on illicit substances. And just in case you don't know, because I have to say this in my head just to wrap my mind around how much $1 billion is. But if you had $1 million 1,000 times, you would have $1 billion. So if you had $150 billion, that would be the equivalent of $150,000 million. So you have $1 million 150,000 times. So we are spending $1 million 150,000 times every year in the America on illicit substances. And the reason Dr. Hart points this out in his book is it's like, look, that's a ton of money. Poor people cannot afford that. The people that we have in our head, these people whose lives are ruined by drug use, cannot afford that. So where is all that money? Who is spending all that money on illicit drug use? It's in the closet users. And I want to say like Dr. Hart, except Dr. Hart is not an in the closet user. He's very transparent about his drug use, but it's successful people who go to work on time. They have families. They are responsible individuals. These are the people that are buying the drugs. It's not the poor person. They don't have money to support it. There's no way. There's no way. So where does this leave us? I mean, what if methamphetamine, heroin, psychedelics really aren't that bad of drugs? And what if they actually can enhance our life? And what if we have a very good relationship with these drugs, what if they just make our lives better? Then what? I think that's kind of like the lingering question here. Then what? What does that mean for all of us? And I guess I should say at this point, I am a regular user of marijuana. I've been using it probably for maybe the past year or two, and I generally use it to help me sleep. I take indica, I take an edible at night. It really helps with my insomnia, and I can assure you that it's absolutely enhanced my life. Marijuana has absolutely enhanced my life. And an additional benefit is that when I take it, it puts me into that kind of daydreaming state, and I get to think about my thoughts, ponder philosophically more easily, and it's just very enjoyable. And then I also notice that when I'm high on marijuana, I am much more relaxed, and things that might kind of aggravate and irritate me, I can sort of just brush them off like, it's not that big of a deal. It's really weird. And then something else Dr. Hart points out in his book that I think is really important is this. He says that the enforcement of drug laws, regardless of the country, is frequently carried out in a selective manner. Individuals from despised and marginalized groups are disproportionately targeted, arrested, and imprisoned for drug law violations, even though recreational drug use is common in every strata of society. So he's saying like pretty much every person on any socioeconomic level is using drugs, but it's these marginalized groups, these impoverished groups that are targeted by local law enforcement. They are the ones that are imprisoned. They are the ones that are fined, typically, not people that have money and that are doing it in the closet and have the ability to conceal their drug use. And so this is what he says. He says, overwhelmingly, the targeted are resource poor people, and their ability to obtain appropriate legal representation is practically non-existent. So it's like, well, maybe the reason we have these drug enforcement rules and regulations and laws and all that isn't really about keeping people safe. Maybe it's about keeping the people that we don't want in the world imprisoned. And then Dr. Hart mentions black people are much more likely than their white counterparts to be arrested for drugs, even though both groups use and sell drugs at similar rates. And he mentions how in the early 1900s, there was the scare of the Negro fiend, the black man who used cocaine and would subsequently become violent during congressional hearings. Expert testimony was given that most of the attacks upon white women of the South are the direct result of the cocaine-crazed Negro brain. And it's crazy, it isn't really that hard to find data that supports continued racism and unjust discrimination against blacks as it relates to drugs here in the United States. A quick and easy Google search landed me on a PubMed article titled Comparing Black and White Drug Offenders, Implications for Racial Disparities in Criminal Justice and Reentry Policy and Programming. And according to the authors, the overwhelming increase in incarceration attributed to the drug war has disproportionately impacted black communities. In 2011, blacks were incarcerated at a dramatically higher rate than whites, 5 to 7 times more, and accounted for almost half of all prisoners incarcerated with a sentence of more than 1 year for a drug-related offense. It's just, it blows my mind. And I'm one of those people that's like, if what you do with yourself and your body, and as long as you don't affect other people, and I get it, yes, I understand how drug use can potentially affect other people, but generally speaking, I mean, if you do an illicit substance and you're just out there doing it and you're not affecting anyone else, why on earth would we imprison someone for that? It makes no sense. He even talks about in his book how drug use really is a constitutionally protected activity, and it doesn't happen here in the States whatsoever. That same study that we were talking about that cited 5 to 7 times blacks were 5 to 7 times more likely to be incarcerated for drug use. They also point out something else that's kind of interesting. It's how our nation has viewed and responded to our current opioid crisis. The authors say this crisis, the opioid crisis, is one viewed with compassion, where opioid addicts are offered treatment options rather than facing the punitive effects of the law. And the authors believe that is because the opioid crisis carries a white face. It's your suburban white kid who's addicted to opioids, not the black kid in the inner city, right? The authors continue, the drug epidemic is seen as a health crisis, whereas when the black community was struggling with cocaine addiction in the 90s, it was met with war tactics in affected communities rather than compassion for offenders. On page 20 of his book, Dr. Hart echoes the similar sentiment, stating that entire police units are deployed to poor, usually black or brown neighborhoods, making excessive drug arrests and subjecting targeted communities to dehumanizing treatment that ends up devastating these communities. So in his book here, Dr. Hart does make a very clear connection between racism and how drug laws are enforced here in the States. When I first made this video, I had made a transcript for it and I tried it and it just came out horrible. But I want to read this section here because I guess this is why I'm not surprised. It's only been a few hundred years since we've abolished slavery. We are genetically the same people as we were back then. It's not as though humanity has drastically changed since those deplorable times. The profound and unspeakable trauma still lingers in all of us, slave and enslaved, visibly and invisibly, and the ideas behind something so wretched as slavery often take generations of dissolution before they are completely extinguished and forgotten. And in the interim, you'll often have stark residual outcroppings like Jim Crow laws, the war on drugs, that serve as reminders that even though slavery has disappeared, America is far from being absent of racism. And as Dr. Hart points out in his book, Dr. Hart is a black American male. He says that the war on drugs, this is such an awesome statement. He says the war on drugs has never been a war on drugs. It's always been a war on us. So I highly recommend this book, Drug Use for Grownups. And I'm curious, what do you think? What are some of your personal experiences with these illicit substances? And I'm kind of curious to see people out there who have an opinion that sort of contradicts what he's talking about in this book. And how do you reconcile your experience with the evidence provided in this book that really does show that these illicit drugs aren't really as bad as we think they are? And if the evidence is true that what he's showing, how do we reconcile the two, our personal experience and being completely brainwashed about drugs seemingly our entire lives, with what the research is showing? How are we to reconcile? How are we to sort of make sense of it all? Leave me a comment. Thanks for watching.